Hello, my name is Linda Haslam-Stroud, and I'm very privileged to be your provincial president of the Ontario Nurses Association. ONA is Canada's largest nursing union. And I'm here today to wish all of our nurse practitioners a happy Nurse Practitioner Week, which we're celebrating November 8th to 14th. And we're celebrating to bring you the recognition that you absolutely deserve in your role as nurse practitioners across the province, and to also increase the awareness of the exceptional care that our NPs provide to our patients, our clients, and our residents. This is an opportunity not only to celebrate, but also to call for the removal of some of the unnecessary barriers that our nurse practitioners have when they're practicing, and to provide a province-wide wage scale for nurse practitioners, ensuring fairness and equity no matter where you work in Ontario. The nurse practitioner's practice is grounded in values, in knowledge, and theories of professional nursing practice. It emphasizes health promotion and the prevention of illness, injury, and complications for their patients, clients, and residents. NPs provide in-depth health assessments, diagnose, order laboratory and diagnostic testing, and prescribe medications autonomously. Our nurse practitioners work in a variety of healthcare settings across Ontario. Nurse practitioners work in NP-led clinics, hospitals, community health centers, family health teams, public health, and certainly in long-term care facilities. They work as primary healthcare practitioners, adult nurse practitioners, and pediatric nurse practitioners. And as of 2015, there is over 2,600 nurse practitioners now across Ontario. Despite our nurse practitioners' high level of skill, they are facing ongoing barriers to practice to the full extent of their training and their abilities. As you probably know, in 2012, the federal government created regulations under the Controlled Drugs and Substance Act to allow our NPs to prescribe controlled substances. However, until that Ontario law is changed, nurse practitioners in Ontario are still prohibited from doing this practice. And it's really unnecessary and an outdated barrier for our NPs practicing to the full extent of their expertise and their education. As president of the Ontario Nurses Association, proudly representing nurse practitioners in Ontario, I call on the Ontario government to allow NPs to better meet patient needs in accordance with their high level of training. And we need the Nursing Act amended. We need it amended to allow our nurse practitioners to prescribe controlled substances. There's also other issues that we are trying to address for our nurse practitioners. I'm also calling on the government to appropriately fund nurse practitioner positions across Ontario. I also call on the nurse practitioner employers to step up to the plate and recognize the valuable role that nurse practitioners have in providing care in the system. We as ONA have 43 or 45 years of experience in negotiating and improving the working conditions for our members. We will use our experience to continue to leverage your employers and the government to ensure that our NPs, no matter where we work, will have a voice in the future. ONA is committed to improving and working towards a provincial standard wage scale that demonstrates fairness and equitable treatment for our nurse practitioners across the province, no matter where you practice. So we have a ways to go. We have an uphill climb, but I can commit to you as the president of ONA that ONA will continue to work side by side with our nurse practitioners, advocating on behalf of you, improving your socioeconomic welfare and your working conditions. On behalf of ONA and the Board of Directors, I wish all of our Ontario nurse practitioners a happy Nurse Practitioner Week. Thank you. Thank you for the vital role you do have in providing high-level quality care to the patients of Ontario each and every day. Take care.